The COVID-19 pandemic is hitting people around the world disproportionately, further disrupting the lives of the most vulnerable and marginalised members of society. Refugees are struggling to secure their livelihoods, losing access to vital public services, including health, water and appropriate housing, and also social distance themselves as needed during this pandemic. A fire on the Greek island that made thousands of asylum seekers homeless earlier this month casts a spotlight on the grim reality that 79.5 million people have been forcibly displaced around the world, according to the UN Refugee Agency. And if their situation is not addressed immediately, the crisis is bound to worsen. To discuss this today, I'm joined by Dr. Aditi Hazra, Assistant Professor of Medicine at Harvard Medical School. Thank you so much for joining us from Boston.
Thank you. It's good to be with you.
Great to see you. And we also connect with Dr. David Abraham, Professor of Immigration and Citizenship Law, Professor Emeritus at the University of Miami. Thank you for joining us. It's great to have you on the program as well.
Very much my pleasure.
Well, let's start with you, Dr. Hazra. So first of all, getting to this terrible spiralling crisis, how much more vulnerable are displaced people in refugee camps to the COVID-19 pandemic?
Sure, thank you. The refugees are not able to physically distance, so access to preventive services such as masks, hand hygiene kits, testing and tracing is essential. Second, when crises strike, gender inequalities are exacerbated. We need to address gender-based violence and women's health issues, including reproductive health. Third, food insecurity can lead to malnourishment, which can in turn impact their immune system's ability to fight and respond to COVID-19, making them more susceptible to the disease. And last, for refugees, non-communicable diseases such as heart disease, diabetes are often neglected. These are comorbidities and increase one's risk for COVID-19, making them more vulnerable. And what we ignore today can be the preventable deaths of tomorrow. So it's urgent to also consider non-communicable diseases.
So really, they're exposed to all these dangers already, and many displaced people around the world, they live in very squalid conditions. And Dr. Abraham, roughly 12,500 refugees were living in the Moria camp in Greece that was built to hold less than 3,000, according to the Associated Press. But this problem, the refugee crisis in Europe, has been growing in recent years. But why has the continent failed to make significant progress on the crisis over the past few years?
Well, I would divide your question into two parts. The short-term crisis highlighted by the arson and destruction of the refugee camp in Greece, and then the longer-term crisis, which is now 5 or 6 years old. So in the short term, borders are closed. One of the great accomplishments of European unification was the so-called Schengen Agreement, allowing for movement throughout the EU, free movement throughout the EU. Those borders are now closed, and that is particularly a problem for refugees in Greece stuck there, who would have no opportunity to travel elsewhere in the European Union. Greece is not the place they want to be. It's not their final destination. It's one of the poorer parts of Europe. They have no desire to be stuck there, but they are stuck there. And the European Union has something called the Dublin Agreement, which requires that refugees make their claim for asylum in the first place they arrive. This has put a great deal of pressure on Greece and Italy, and Malta, to a lesser extent, Spain. So people are stuck in the first place that they have reached. In the larger picture, going well beyond the 13,000 people on the island of Lesbos now, in the larger picture over the last 5 years, when you think that there are 2-3 million people at issue here, the glass can be seen as half empty or half full. On the one hand, the countries of Eastern Europe remain adamant in their refusal to take in any refugees. Those countries which did more, Germany, Sweden, to a certain extent, Spain, have had mixed success. I mean, it's 5 years later, and only 30% of the refugees who were admitted in 2015, 2016 have full-time employment now. That means that 70% are still either living off state charity or private charity. They have not successfully been integrated. You know, most of the refugees coming to Europe are from rural backgrounds. There is a certain educated stratum from Syria and elsewhere, but from Afghanistan, from Iraq, and even from Syria as well, most of the people are coming from with relatively limited education and from rural backgrounds. The economy of Germany, the economy of Sweden, the economy of most of the European Union cannot work with that labor supply. 50, 70 years ago, there were mines, there were steel mills, there was physical labor to be done. Today's so-called knowledge economy has a difficult time absorbing these people. And then there, of course, there are cultural tensions as well. So on the one hand, one can say the glass is half empty. On the other hand, given the difficulties at integration, one can also say the glass is half full.
So really there are both short and long-term risks, long-term complications that countries are really struggling to deal with here. And well, Dr. Hazra, would you say there are any countries that you feel have done well in addressing the refugee crisis in their pandemic response?
Thank you for that question. I think Portugal's decision to grant temporary citizenship rights that includes access to the national health system and social protection services to all migrants and asylum seekers with pending application is inclusive and an adaptive leadership response. They implemented this in March of 2020, and it will extend through October 31st. This enabled trust among the refugees and the host nation, and it gives us a benchmark for true adaptive leadership.
And Dr. Abraham, Germany made a rather unprecedented move of deciding to accept more than 1,500 refugees from Greece. What do you make of this development, and what do you think really are the factors that paved the way for this to happen in German society?
Well, I wouldn't exaggerate the generosity of that small number, but I would say the following. You know, Germany is a dominant country in Europe. It has tried to get other countries since 5 or 6 years to share some of the numbers, share some of the burden. They have not had an especially successful result in most places, but particularly vis-a-vis Greece, the European Union and Germany in particular came down very hard on Greece during the financial crisis and the debt crisis. So there's some sense of owing the Greeks a bit of deference on this score. And Germany's economy is remained, despite the unemployment caused by the COVID epidemic, the economy there has remained stronger than, say, in France or Italy. So I think that's one reason for the initiative. Much more needs to be done. It's also the case that public health is not always a matter of generosity. Public health measures can also be extended to people because you don't want them to get you sick. So there is fear animating some of the generosity as well as generosity.
I see. Well, Dr. Hazra, it's clear that leadership is needed in dealing with the refugee crisis, which really is a borderless crisis. But President Trump on Friday said that his rival Joe Biden would turn Minnesota into a refugee camp, and he even bragged about deporting Somali people. I mean, what do you think about this?
The United States is home to an inclusive and multicultural population. Immigrants, including refugees, migrant workers, contribute to the U.S. economy, and many have served on the front line of the pandemic in the healthcare system, as well as in the food industry as essential workers. Minnesota is home to approximately 50,000 Somali ancestry individuals, but it is not the largest host of Somali refugees. Kenya hosts the largest number of Somali refugees. All the member states of the United Nations signed the 2016 New York Declaration for Refugees and Migrants. And this declaration states that member states will share the responsibility to protect and support refugees and displaced individuals. I believe that the United States and the international community should honor this declaration and the Global Compact for refugees. The health of each of us depends on the health of all of us.
And what are your views on this, Dr. Abraham? I mean, should a humanitarian crisis like this be politicized?
Well, it's going to be politicized, whether it should be or not. I think in the case of President Trump, if he is to be reelected, he has to, in the first instance, solidify his support amongst the 30 or 35% of the population that's bitterly opposed to immigrants, especially to Black immigrants. And this is more rhetorically for their benefit than an actual project. Somali Americans, Somali refugees, now Somali Americans, quite well. Representative Ilan Omar, a member of Congress, is in many ways indicative of that, not without problems. Any immigrant group has its problems, but of the successful integration of Somalis. So I don't think there's any reality to the boastful claim that he will deport Somalis. It's not going to happen. It has a political function. It doesn't have a legal point to it.
And Dr. Hazra, what would you say right now is the biggest challenge at the moment in the protection of migrants during this COVID-19 pandemic? And what do you think really is needed as we prepare for the new normal?
Sure. I think international solidarity is needed. One of the biggest challenges is not having universal health coverage, which is a UN Sustainable Development Goal. My vision is to see prevention services prioritized in the new normal. So this would include masks, hand hygiene for COVID-19, as well as prevention of comorbidities such as heart disease, diabetes, and cancer, which are rising. One of the other aspects I'd like to raise is that 40% of the refugees are children under 18. September in the United States is back to school for many children, whether that's in person or online. For many refugee children, that is not an option right now. A study recently said that 50% of refugee girls may be unable to return to school, even if the pandemic ends. That is unacceptable to me.
Really
With gratitude, sorry, just one last comment I would say on the gender equality. With gratitude and in honor of Justice Ruth Bader Ginsburg, we all need to advocate for gender equality.
Well, as you mentioned, Dr. Hazra, it's really heartbreaking, really, that these displaced people, they're already facing such uncertain futures, but even their access to basic amenities, to education, human rights, it's all being even more compromised by this pandemic. And well, Dr. Abraham, with no end in sight to this pandemic, then how do you think we should really prepare for a new normal so that these refugees can exert their basic human rights and their rights to basic health services and the protection that they need, as Dr. Hazra has just mentioned?
Well, I certainly agree that all human beings should enjoy the benefits of some decent minimum of health care. Of course, as you probably know, in the United States, this is not available to altogether too many even citizens of the United States. So I would not foresee sudden expansion of medical assistance to those who are not or not yet part of the community, let alone the citizenry. But I hope that the new normal does not consist of endless pandemics. So when I think of the situation that will follow getting this pandemic under control, that we need to pay attention to the causes as much as to the effects of the crisis. So peace in Afghanistan and in Somalia, reconstruction in Iraq, an end to the civil war in Syria, these would be more helpful developments for refugees than trying to press rich countries to devote X percent of their wealth to softening the refugee crisis, fostering economic development in North Africa, dealing with the desertification of much of the African continent being occasioned by global warming. These are causes that have to be looked on straight in the face and not simply through their effects, such as the refugee crisis. So I think we have to have the education and training and health measures that my colleague has indicated to get through this crisis. But in the longer run, we need redistributional programs, coordinated immigration possibilities, as well as peace and prosperity to the countries that people are fleeing.
So really it roots back to these conflicts and these climate change challenges that refugees face in their home countries as well. We need to help tackle all of these fundamental issues as we look to the solutions for the future. Well, I'm afraid this is where we're going to have to end the discussion today, but that was Dr. Aditi Hazra, Assistant Professor of Medicine at Harvard Medical School, joining us from Boston, and Dr. David Abraham, Professor of Immigration and Citizenship Law at the University of Miami. Thank you both so much for joining the program.
My pleasure. Thank you.
My pleasure as well.
And to our viewers, thank you as always for watching. We'll be back tomorrow with more global insights on the latest news stories. Hope you join us then. Have a good one wherever you are. Bye-bye.